guys, my name is Kels and I'm here to talk to you guys about the real COVID-19 situation going on in China. Keep in mind that I am speaking 100% based on my family's own experiences. Does not including like entirety of China. I'm just speaking from my own. My family lives in Nanjing, China, and in Nanjing we never experienced a total lockdown. Everything was going under control. People were doing fine. They were able to shop for groceries and even work sometimes. Until around like 3 weeks ago, that everything, like entire country was opened up and situation started to get very severe. And currently, almost all my family is infected with COVID-19. My grandpa got infected. He got infected after he went to get a haircut. And soon, my aunt who lived with him also got infected. My grandpa was relatively healthy for a 92 years old. He lives on the 6th floor and he was able to climb up and down the stairs for 5 floors, no problem. The only pre-existing condition he had was high blood pressure, which many elderly people has. And it started with a severe cough. And after several days of coughing, he started experiencing nausea and vomiting. And as soon as he started feeling better, he could not make it. He passed away. And when the ambulance arrived, half an hour after we called, he was already out of breath. And after the ambulance checked on him, they were not able to take his body out of his house right away. And they basically had to wait like 2 days to get his body taken out of the house and cremated because of the crematories were packed. And I also heard from the health officials saying they basically burn around like at least 200 bodies per day in one crematorium. Not only my grandpa and my aunt, the rest of my family member also got infected with COVID-19. My uncle, my other aunts, my 2 cousins and their wives, their extended family as well, and even the children. My cousin had a pre-existing condition with his lungs. He almost did not make it. His condition was so severe that when he goes to the hospital, he was suggested for inpatient stay. However, the hospital was so packed that there was no room for him to stay. So he got treatment at the waiting room, and they had to put in the intravenous shot for him consecutively for 2 days in order to save his life. And what he told us about his experiences in the hospital is that the respiratory mask that was used to pump air towards the patients in order to help them stay alive, the doctor had to make patients share the respiratory mask. One patient will be in the middle of the treatment, and the doctor had to take the mask out in the middle, sanitize it, and give it to another patient who has condition is more severe in order to keep another patient alive. And that's how dire the situation is, that there was not enough respiratory masks for every patient. Not only that, the cold and flu medication was out of stock as well, and we had to buy cold and flu medication here for people to take it to China. The COVID situation is so bad in China. Even when I go on the entertainment forums, normally that I go, which people normally discuss, like manga, television shows, dramas, you can just like see forums of people discuss their infection with COVID-19. Almost everyone I know and everyone I don't know either got COVID themselves or knows somebody else they're close to got infected. The symptoms range from mild to severe. Some symptoms including coughing, high fever, low fever. Fever typically range from like 3 days to 5 days. Vomiting. Some people will cough up blood from like coughing so much. Nosebleed. Temporary loss of hearing. And many elders, just like my grandpa, did not make it and died from COVID complications as well. And at this point, it might as well assume that everybody is getting infected with COVID over there. Even though the disease has a low death rate, the amount of people who has been infected and the death toll that I definitely think is higher than what is being reported. For my grandpa's passing, there's definitely something I wish that as family members that we could do better, and something that I wish the government could do better. And as for our family members part, my grandpa was not vaccinated, and the reason he was not vaccinated is because he was worried that he couldn't handle the side effect from COVID vaccine due to his old age, which we let him make his own decision, but we know that getting vaccine is crucial. And I understand, in the same time, understand why some people was hesitating for the vaccine. For example, like very old age, very, very young, or having like a bunch of pre-existing conditions, or being pregnant and stuff. If I could go back in time, I would definitely suggest my grandpa to talk to the doctors about, his age and if he's worried about the side effects, and then encouraging him to get vaccinated. And sometimes I even wishes that, unless the doctor says that his condition is not like does not suggest him to get vaccinated, I sometimes wishes that the government or our family could force him into it. I know like many people believing these like conspiracy theories about like Chinese vaccines, like the Sinovac, like it doesn't work and all that. Like my mom is one of them, but guess what? Like it works, cause my aunt, she is 72 years old. She got vaccinated with all 3 shots, and getting the vaccine and the booster is definitely really important. She also got infected. She has like heart conditions, high blood pressure, and recently she diagnosed with thyroid cancer, and she was able to make it alive. And my cousin was able to make it alive, even though his condition was severe. But again, his pre-existing condition was his lungs, and this virus attacks the lungs. And even though I wish my family and us could do better at preventing the situation that happened to my grandpa, I also wishes the Chinese government could do better as well. For example, that after like a completely lockdown, that like they suddenly like opened up everywhere at the same time, and then even in some places that like people with like mild COVID symptoms can suddenly go to work now, which is not good because it exceeds the spread. And this Omicron variant, or any variant really, has a very high infectivity, and the virus kills the very old and very young. And even the majority of people was able to make it, but my grandpa couldn't. And not only that, I really wishes that the Chinese government could accept the mRNA vaccines as an alternative, because of, yes, the Sinovac does work on saving our families' lives, but like some people after they vaccinated with the Sinovac, like my cousin, they could still have severe conditions, and the people with severe conditions, they could still crowd the hospitals. And but for people who got the mRNA vaccine overseas, like myself, for example, when I got COVID-19, my symptoms are very mild. The early symptoms I experiencing were coughing, fatigue, and eye pain, and I didn't have to go to the hospital, and the hospital could save more health equipment for people who has more severe conditions. And then after 3 years of lockdown in China, instead of testing everyone about COVID like every day, they should prepare more on like medications, medical equipment, etc. The last thing that I am currently disappointed about is the dishonesty China gave their death toll on COVID-19. And on the Google officially, the death number is very, very low, which is absolutely bullshit. Since like there are deaths happen in our house. My grandpa died from COVID complications. The health worker from the ambulance who took my grandpa's body away, they told us they burned at least 200 bodies in one crematory. And what I heard from the news is that they are only documented deaths caused by pneumonia and respiratory failure as deaths caused by COVID, which is just bullshit. Because even though my grandpa did not die from pneumonia or respiratory failure, he died because of COVID-19 complications. And if he didn't have COVID, he could have a longer life. And it's such a shame that his death would not even be one of those numbers. Overall, I wish China could get through this soon. Families are suffering. People are getting infected. The elders are dying. The health officials are working their asses off. There's not even like, people couldn't even get their body cremated right away. My aunt had to wait it for 2 days until they taken my grandpa's body out of his house. And many parts of the world, in the States, we experienced similar situations like this before. Thankfully, because of vaccines, we're going back to normal. I wish this COVID wave could end soon, and then there will be less people pass away. And I hope that people who are getting infected with COVID are getting better. And I hope everyone have a very happy, healthy, safe New Year. Goodbye.